Are you ready to master Next-Gen NCLEX questions? Let's break down real case studies step by step. Case study scenario. Question 1. Matrix multiple response. A nurse is assessing a patient who is post-op after an abdominal surgery. Which findings should be reported to the provider? Click yes or no for each option. Fever above 101 degrees Fahrenheit suggests infection, gives report. Mild redness is expected and early healing, gives no need to report. Unrelieved pain could indicate complications, gives report. Serous drainage is normal, gives no need to report. Low BP could indicate internal bleeding or shock, gives report. Question 2. Bow tie scenario. Case. A patient with heart failure presents with worsening shortness of breath and a weight gain of 5 pounds in 3 days. What condition is the patient likely experiencing? Fluid overload. What action should the nurse take? Elevate head of the bed to improve breathing. Administer furosemide as prescribed to remove excess fluid. Monitor daily weight to track fluid retention. Encourage increased fluid intake, worsens overload. Discontinue oxygen therapy. Oxygen is needed for SOB. Explanation. Fluid overload in heart failure leads to weight gain, shortness of breath, and swelling. Diuretics help remove excess fluid, and elevating the head of the bed helps breathing. Increasing fluids would make it worse. Question 1. Multiple response. Which of the following assessment findings indicate that Mr. Carter is experiencing worsening heart failure? Options. A. Crackles in the lungs. B. Increased urine output. C. Jugular vein distension. D. Dry mucous membranes. E. Pink frothy sputum. Correct answers A, C, E. Rationale. A. Crackles in the lungs gives fluid accumulation in the lungs due to worsening HF. C. Jugular vein distension gives increased venous pressure due to fluid overload. E. Pink frothy sputum gives indicative of pulmonary edema, a severe complication of HF. B. Gives HF often leads to decreased urine output due to poor kidney perfusion. D. Gives not a typical HF finding. Dehydration may cause this. Question 2. Drag and drop, prioritization. Arrange the following nursing interventions in the correct order of priority for Mr. Carter. 1. Administer furosemide 4. 2. Place the patient in high Fowler's position. 3. Monitor potassium levels. 4. Educate on daily weight monitoring. 5. Administer oxygen therapy. Correct order. 5 gives 2 gives 1 gives 3 gives 4. Rationale. Oxygen therapy first. High Fowler's position. Diuretics to remove excess fluid. Monitor potassium. Patient education comes last once the patient is stable. Question 3. Trend analysis. Mr. Carter's urine output has decreased to 200 milliliters in 8 hours, and his creatinine has increased to 2.0 milligrams DL. What does this indicate? A. Effective diuresis is occurring. B. Worsening kidney function due to fluid overload. C. The patient's condition is improving. D. The patient needs increased oral fluid intake. Correct answer. B. Worsening kidney function due to fluid overload. Rationale. Decreased urine output and rising creatinine indicate worsening kidney function, a sign of severe HF. Key NCLEX takeaways. Recognize worsening heart failure. Prioritize oxygen, positioning, and diuretics for fluid overload. Monitor labs for kidney function and electrolytes. Patient education is crucial for preventing readmission. Thank you so much for watching today's video. I hope you found these tips and strategies helpful for your NCLEX preparation. If you did, please give this video a thumbs up and consider subscribing to the channel so you don't miss any future content on NCLEX tips, study strategies, and nursing license guidance. Also, I'd love to hear from you. Drop a comment below and let me know what topics you'd like me to cover next, or if you have any questions. Your feedback helps me create content that's most helpful for you. Thanks again for watching, and I'll see you in the next one.